I got into a caregiving role. My mom became a widow. She eventually had some medical issues, and I started slowly caregiving with her until it became a critical care situation where she was having medical emergencies. And I ended up going beyond the caregiving role to the patient advocate role, which is a little different. It's still part of the caregiving, but just another ballgame, really. And I had no idea what a patient advocate was supposed to do. I didn't even know what her rights were as a patient, and I didn't know how the medical system works. So I really went into this with no idea, and basically it did not end well. A lot of things that she wanted never to happen ended up taking place, and it just left me with some sense of guilt, I guess, because I felt like I should have done better, but I didn't know what I should have done. And I realized that I needed to do something to understand this, so that my son, my two grown sons, and my husband wouldn't be in the situation that I had been in, that they would not have to do what I had to do. So I started asking questions, and as a journalist, I guess my journalism hat came on, and I started doing research and trying to figure out why, what happened, and put something together. And part of that was sort of retelling my mom's story, and I ended up telling it in short stories. That's how I ended up unfolding her story in 11 short stories that kind of explained our journey together with this patient advocacy. And then I put the book together. I had a guide at the end of some things that I had found that made sense, that I wish I'd known. And I decided, okay, I need to show this to a medical professional and see what they think. And I knew about Dr. Hanslick. I knew that he was a very patient-centered doctor, a real patient advocate. He had been, at that point, he had been in practice for about 45 years. He was an internist. His focus was functional medicine, which has to do not just with the physical body, but the mental, the environmental relationship, everything about that affects our health. He was someone that was very into that. And I felt like he could give me a good perspective. So I asked him to review the book. He said yes. I sent it to him. And the response I got back to him just was almost shocking to me. He said, this is a story that plays out thousands of times a day in this country. And I was so surprised by that, because I thought my story was unique. I had no idea. So I said back to him, well, do you have something to say about that? And he said, I absolutely do. And so I ended up interviewing him for the book. I call it my office visit with him. And I named it The Doctor Is In. So after Mom's story comes his part, which is The Doctor Is In. So I had this book, and I just felt like, this is information that needs to go beyond my family. This is something I need to share, because I just talked to more and more people who just were in a similar situation that had no clue what to do. So I've got two goals with this talk that I'm going to do right now. The first is to maybe contribute a little to your understanding about patient rights and about the role of the patient advocate. That's the first thing. And the second is to help you as an advocate or your loved one feel more empowered in the medical care system and feel more effective in the roles that you have. So to do this, I'm going to use the book cover. And here it is. Probably you guys, know about it already. But I'm going to start with looking at the illustration here. And that's what I'm going to begin with. So basically what we have is somebody probably in a hospital bed. We've got, the hospital, the ambulance, the medications, and syringes. I mean, all this stuff is going on in the hospital. So basically for the patient, they're kind of taken out of their normal routine, their normal environment, especially if they have any kind of dementia issues. Their cues, their daily cues are kind of taken away from them. And they're put in this kind of, it is a sterile environment, but it's not a stimulating environment at all. And then they have people walking in that they don't know, helping them. And in this case, as of today, they've got masks on top of everything else. And there's just, there's a lot going on for that person going in there. They may be in pain. They're definitely not feeling well. They may not have had much sleep or not been, have eaten well. They may be concerned about what's going to happen. There's that question, that fear of what's going to happen. They may be anticipating this is going to be painful, whatever it is. And it's also an isolating situation. They put you in a room. It's kind of a hectic environment, people running in and out, doing tests, talking to you. And it's like, it's one of those situations where you really feel like you're kind of out of your element, for sure. And as Dr. Hanslick points out, one of the first things they ask you to do once you get in the hospital is to take your clothes off. And there's something about that that makes us feel vulnerable all of a sudden. So there's that element of it too, even though we know that's logical and that's what needs to happen. Then if you want to go to the bathroom, you have to ask permission. If you want something to eat or drink, you have to ask permission. And it just changes, your whole dynamic of what you're used to. So when all this happens, of course, you're not thinking clearly. And so it's good to have an advocate. It's good to have somebody there that when the doctor comes in to talk to you, there's another set of ears and eyes that can, kind of look to see what's going on and to help you out. So now I want to talk about the title. And the first part of the title is speaking up. And I want to kind of go into that a little bit. Because right now what I'm doing, I'm speaking, right? I'm expressing myself. And there's a phrase called speaking out. And I looked that up in the dictionary, and it means to express one's opinion openly and unreservedly. But that's not necessarily what we're doing here in this situation with speaking up. What we're doing, according to dictionary, is to state our beliefs or objections bravely and firmly. In other words, we are stepping up to a situation where maybe normally we would feel vulnerable, and we're speaking, we're using our voice, okay? And to my sense, what needs to change is the perception in the power balance between the patient and the doctor. It needs to be an equal power balance there. Often we have what's called white coat syndrome, where once we're in this situation that I just talked about, then we have somebody come in with a white coat and authority telling us what's going on and what they want to do and this and that. And there's a sense of not feeling an equal partner in that relationship, not feeling part of the team. And so what we want to kind of understand is we are an integral part of this team. So in order to express ourselves and speak out, or speak up, I should say, speak up, how can we do it effectively? And basically, we can do it effectively in the same way that we communicate effectively in any relationship we have, which is basically to be respectful, to be considerate, to be calm as much as possible, and to be well informed. I mean, this is coming straight from Dr. Hanslick, because I asked him in the book, I say, how can we best communicate with doctors? And he's basically saying, treat them as human beings, treat them with respect. But, if you have concerns or questions, speak up. And the other thing is, on the other flip side of that, of course, not to be demanding, not to be emotional, and not to be antagonistic, to really try to convey what you're trying to do in a way that can be heard. And we all know this, right? People come at us with emotion and all this other stuff. We shut down immediately. And I've had that experience with doctors, and I know they will do that. So it's best to try to keep it really as civil and as focused as you can. But if you have a concern, definitely you need to speak up. So now that we're going to speak up and we kind of know how to do it, what are we going to say, right? What are we speaking up about? And so as an advocate, we've basically got 3 different scenarios where we need to be there. The first is to support our loved one in expressing their healthcare wishes by playing the role of what I call the amener. And basically that is whatever they want, you as the advocate are like, yes, that's what they want. How do we get what they want? That's what you're there to do. You're not to question the patient. Are you sure that's what you want, honey? Or, well, maybe the doctor's got a better idea. No, it's like, this is what the patient wants. This is what the patient wants. That's what your point is. The second time you may, or a second sort of scenario where you may be needed is when the patient can't express for themselves. They might be too ill, or they might be in a coma. They might be having a mental illness situation or a dementia. And that's the point where they cannot coherently speak with the doctor. And I remember in one of the things Dr. Hanslick mentioned, he said, when do you know when the advocate should begin speaking for the patient? And that is at that point where they cannot coherently communicate with the doctor. That's when the doctor needs someone that they can communicate with, and that's when you need to step up. So this is the time to do that. And how do you do that? You have to know what the patient wants. If you're in that situation where you have to speak up for your patient and for your loved one, and you don't know what they want, it's not a good thing. I can tell you from experience. So you have to know. And how do you know? You don't wait until that moment when they're in the hospital and start asking them what they want. That's not the good time. You have to ask them ahead of time, when they're calm, perhaps when they're feeling at their best or as best as they can be, and when they can talk reasonably about it. And at that point is when you can find out what they want. And of course, it's really important to realize that we are here as a support. We're not here to consult them. The doctor does the consulting. We are there to support the patient. So it's not our place to try to guide or steer what they want. I mean, think about yourself. I mean, this is what I have to think about when I'm advocating for somebody, is if I was that person, what would I want? Would I want someone trying to tell me to change my mind, or would I want them to do what I want them to do? And if I go back to that, it's a lot easier for me to advocate for somebody.